welcome. My name is Jacek Gonos. I'm from Poland and I'm here to talk with you a little bit about the lip augmentation in the patients who had occasion to do it for the first time. I know some of you starting a career with aesthetic medicine, so I would like to tell you something which can be helpful in the beginning, speaking about the lips. We will go fastly through some important points, in my opinion and my experience. So the medical history, expectation of the patients, and the making of the documentations. So from the medical history point of view, there are some points we have to go through. If we do the informed consent of the patients need to make papers, the patients need to write down some information about themselves. And that's the point I think are really important, starting from diseases, especially the autoimmune. In some cases, which are really common in our part of the Europe, let's say the Hashimoto, some of the procedures as lip augmentation in case of acute Hashimoto are strictly prohibited. So that's the first thing we need to ask the patient. Of course, there are other diseases like diabetes mellitus, autoimmune diseases based on the connective tissue. Yeah, so we need to talk and take to the account all of the informations the patient can tell us. Yeah, the drugs are important from point of view that if we work in the lip area, some of the products have also some addings. Yeah, there are only little bit of them, but they can go into the cross reaction. That's the important from our medical side, and also from point of view of safety of the patients, and also the blood thinners. Yeah, the lips are really well vascularized, and the thing is, when the patients drink a lot of coffee, drinks alcohol before the procedure, use the blood thinners. Yeah, we have plenty of them from the many reasons. Can be medical, can be also due to the just as a prevention. We have to ask about it, and we have to know that if a patient use it, they can be more hemorrhage or they can be some bleeding. The pregnancy, yeah, as a contraindication to the doing a lip enhancement, and the allergy. Yeah, the allergy from important point of view, the products we use for the lip filler, most of them contain lidocaine. Yeah, there's the product which is used for decrease the pain after ending a procedure, but some people have allergy on it. My recommendation is to put into the informed consent information as a question: do you or did you even have a treatment, the stomatology treatment, the dental treatment, and someone use on you the lidocaine or the local anesthesia, all the anesthesia in a type of the infiltrative or nerve block? If yes, how is going on after that? If there is fine, okay, great. And this is the simple question, because many patients, if you ask lidocaine, they don't know what you're talking about. Yeah, they don't care about it. Nobody is, they have a medical knowledge. Yeah, breastfeeding as a second one, we have to know that many of particles just cross it, and there are no any scientific based evidence that the lip enhancement can be done when the woman is breastfeeding. Yeah, and any accident and surgeries from point of view like me, which I'm doing some parts of aesthetic surgery. Some patients go under some surgery or a cleft lip or post accidents, especially car. Sometimes there is a suturing of the lips. Due to this, you can have internal scarring. The normal component of the lips can be changed, and due to that, what we are planning on the patients to do can give a completely different or opposite effect we would like to achieve. And also the previous fillers. Yeah, we have to know that the hyaluronic acid fillers, which are recommended by the companies to the lips, are not disappearing immediately. They stay for some years. These days, there are also speak that the hyaluronic acid is semi-permanent. Yeah, so we have to take it into the account. We have a fat. If the patients say us that had a contact with a surgeon, plastic surgeon in the past, we have to also take into account, maybe they done the lips by the fat, by the lipotransfer. Yeah? So this is also important from this point of view, since the result can be completely different. And as the last one, the silicone, which is in Europe that not used that common, more in America, but from time to time it also happen. Yeah. So the expectations. We have to talk with the patients what you want to achieve. Yeah. The thing is, if the patients come to us, we will not, as a doctors, tell patients what is wrong. We want to ask and hear the patients what they want to change. And that's the most important thing. Many patients will come to your practice to show you the Instagram pictures with lips, also maybe with some digital filters, which completely change the point of view of the patients. And you have to somehow tell them that this is not that real that they think it is. The patient's behavior, and from my experience, the patients which are, let's say, addicted from the aesthetic medicine procedures, and they can create you later a lot of problems, because let's say we see what is their behavior, we know that they will not cooperate, they will not let's say take to them the post treatment recommendation, can make us a problem. So we just need to observe the people, read the people from the face, and it can help us to don't have any low problems in the future. Also our aesthetic feelings, yeah. Aesthetic medicine is not creating abnormal shapes of the face. We want to create something which is aesthetic, which is natural, and enhance the natural beauty. So we have to take into the account the lips shape, any asymmetries, the boundaries, and also look that our skills are enough good to help the patients achieve its goal. Because if not, it is better sometimes to say, I'm not feeling enough good to do your lips, because there are some of hard lips, especially for the first time what we're speaking today about. And it will at first give a patient the, if you of course explain it well, the feeling that, okay, if you are not feeling good, I'm really happy, because maybe you will recommend me someone better. And in my opinion, and what's happened in Poland, these patients are really often coming back to you. So it's my experience and my opinion. About the documentation, so the important part of it, the informed consent of procedures. So there we need to put, of course, the most common complications which can appear after that, and the recommendation post the treatment. Of course, the post-medical history, allergies, any previous treatments, and the photographic documentations. Generally, the photographic documentation should be, or have to be, in the same position and same light. In real, this is not that easy to do, and this is not that common, because when we are in a clinic, we are hurry up, and sometimes we just try to do any of picture after done to have a well done pictures. In big clinics, it is done in a special walls or special rooms. There are special people who do it only that, and that's a great opportunity. But mostly you have to do it yourself. So there is quite also a big topic to speak about the photography. And also, if you want to use the image of our patients in the social media, we need to also put a documentation regarding the usage of the image. This is quite important, especially there need to be a highlight in which social media these pictures will be used, yeah, according by the European law. So that's from the important parts. And if we have done all of these steps, we go into the choice of the filler. So in the market, plenty of the brands, different models. The company produce a lot of products. They have also the different composition. Yeah, there is the different density of hyaluronic acid. In some products on the market, they are also adding of the amino acids to achieve the better color of the lips. So the best recommendation, in my opinion, is just to try and find what is the best for you, which product is the best, in which one you feel the best. Yeah, so speaking about the products, yeah, because company, it's one stuff, the company is many of them, I will not talk about it. But about the products, most common classification is regarding the density of hyaluronic acid. They can be also qualified according by the letters, according by the colors, according by the special names. And as I told you, the best choice for us and for patients, this is the experience, so you have to try and find the best option for you and the best option for your patients. And the composition, yeah. So as we talked in the beginning about the allergies, lidocaine, yeah. On the market, products with and without. There is no big difference, yeah. Just only with or without. The price is almost the same. The density of hyaluronic acid is in milligrams per milliliter. The syringes which are appearing in the market, mostly they are 1 milliliter, but sometimes can be 0.7, 0.8, even 1.2. Of course, in the package you have written that there is 1 milliliter, but the company always told us that they give something extra. What you will do with it, it's the needs of the patients. And according to my experience, the best density of hyaluronic acid recommended for lips is like mentioned here. What I recommend you when you start your story with lip fillers, start from the low densest hyaluronic acid. It's easier to work with them. It's easier later to, in the worst case, to solve it if something happens. And also you will not, if you don't, your hand is not well working on the syringe, you will have a great feeling how it's going. What I can say about the concentrations, because this is also across the Europe differ in many places, in many countries. In Spain, for instance, they rather use the densities about approximately 20. In Poland, we work mostly on 60, 80. It's that thing. But everything depends. What are your skills? What are the patient's needs? And what, in your opinion, as a doctor, will be the best option for a patient? Yeah. And the product. When we already choose a product, yeah, we have it. So we need to check some things. From the most important, of course, the valid term of usage. We need to check any signs of damage of the package or the syringe, yeah, if there is no any stain inside, and the needle, yeah, the needle, the thickness depends how easy you will work, how much effort you need to put on the syringe to put the hyaluronic acid inside, but also how much pain the patients will feel. And if we go to the patients, of course, when we're checking it, look always for asymmetries and look always for the borders. Regarding the pain, anesthesia, yeah, we have these days a lot of common options. For lips, these three most common are used, so we have creams and gels which are at a topical anesthesia. Most of them are already pre-prepared. You can order them from internet. After opening, the most important thing, keep it in a cold temperature. Later on, infiltration anesthesia, so let's say lidocaine into the mucosa of our mouth cavity next to the lips, or if someone is enough experienced, we can do the nerve block, which is really common in dental treatment. Everything is the experience. I recommend to start from the topical one and later go on with your experience. Go deeper and go deeper. And if we have someone who is sitting for the first time in your chair, you have to be patient. You have to know that the patients have feelings. Some of them can cry, some of them can be stressed, some of them can told you I have faster heartbeats. That's normal. That's the stress, and we have to take always the more time for a first-time patient, because if you give the patients the space, the safe space, you create between you and them the connection. Like they will like you. That's my opinion. And important point, better less than more. So always we have to know that we are doing the first time lips. I personally don't do them as a one syringe. We have a 1 milliliter at once. I do it mostly 0.7, 0.8, and in follow weeks, after 2-3 weeks, I recommend my patients to come, and if there are any asymmetries, if there are any points they would like to improve more, then I'm doing it. Why not every whole syringe at once? So imagine we have a hyaluronic acid with density 20 milligrams per milliliter. You have really small lips with a lady, 70 kilograms, 155 centimeters grow. And if you give that lot of filler, which will after time take a water inside, the lips will be crazy big. So don't do that. Take your time, talk with a patient, and explain everything. And the post-treatment recommendations, as for the most important points in my opinion, of course in documentation you put much more, but that's what in my opinion is important to say to the patient. Yeah? Not all the patients read the documentation and what is written, but what are you pronounced to them, they will remember. So the drugs, some patients have a reaction as swallowing and edema. It is not a classical allergic reaction, it's not look like allergic reaction, but it can appear. Sometimes it can be not comfortable for them. Then they can feel like they have a really big dark lips. So that's the drugs I recommend to use. Of course, we use them according by the daily doses and the recommendation of the producer and the grammature we have of a given product. We have also herpes simplex, which can appear after the procedure if the patient suffers from a recurrent form. So of course acyclovir, the doses also depend from the how much patient weight and what is the amount of the disease. From important thing, many people have a house animals. We have dogs, we have cats. They have a lot of bacteria on themselves. So we try to do not hug the animals. My recommendation is up to 3 days, as the also recommendations below, and also avoid the exposure of hot water stream, of the cold air in the winter. The high intense sport also is better to leave it until the lips will be healed completely. What else? Hot and cold drinks, that's the important, drinking through the straw. And also for the chronic smokers, I observed that the elderly people, 65, 70 plus, because I also have that type of patients for a first time lip enhancement. There are ladies who smoke 20 cigarettes per day. We're doing a lip filler, and after 4-5 months, there is no lip filler anymore. So this is the real practice of it. And I have in the end some pictures of my patients. This is a 66-year-old woman with history of thyroid cancer. We work here with the hyaluronic acid, which has a recommendation for patients post-cancer after 3 years after completely healed. There is not only lips here. This is the first picture when the patients come to me. As you can see, the many wrinkles, the nasolabial fold is also fall down, everything. I know that these two pictures do not show the whole face, but as I told, this is hard to do the pictures in all the same position all the time. But here we have lips which nobody done before. This is directly after procedure. We did here also the area under the eyes. We did some Botox. We did the nasolabial fold. I remember also the chin. And here is a patient with a next treatment after it's about 6 years after. So the lips were like that. The patient smokes also. Smokes about 10 cigarettes per day. This is the chronic smoker. So this is the treatment after 1 milliliter, as you can see on the time in a smoker. Going next, this is one of the patients also with nobody done the lips before. as you can see, here is only 0.5 milliliters of really low dense hyaluronic acid. This is also directly post procedure. This hyaluronic acid has inside also the amino acid and some vitamins, as I remember vitamin B12. So we can see it was the same room, the same light. You can see what is the difference in the color of the lips. It's really nice. And here you can see also if we have some asymmetries that we try to work of them. With asymmetry, it's important that we are not able to do it at once. We need to work, we need to observe the patients. Patients need to be patient, and they will be really done work after that. And from my side for today is everything. I hope you like the short topic for today. What I can say, it will be really nice to see you in our academy, and I wish you good luck everyone, and see you. Bye bye.